This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Welcome back to the program. Well, we're going to start, first of all, talking about long-term care. We bring an expert in here, Russ McDaid. He's the president and CEO of the Pennsylvania Healthcare Association. Russ, as always, welcome to the program.
Thanks for having me, Terry.
I love the way when in the material that we exchanged, or that you sent to me, you said we're going to sit down together as families, as friends, as intimates, as cronies, however we sit down, right? And guess what? There are important problems that we're going to talk about, even though this is a joyous season, right?
That's absolutely correct. And, you know, we've spoken before. Yeah. We sit down, our families all spend a lot of time planning a vacation and saving for a vacation. We spend a lot of time planning for college and saving for college.
We hope we do.
We hope we do. Few of us spend that time planning for our long-term care, and there's no better time than the holiday season, when families come back together, when sons and daughters from across the country are back home together, working with their parents or their grandparents to say, when the need arises, do we have the knowledge and the things in place we need to make good choices for our family?
Yeah. How many people, and I know you know this, how many people would you estimate are in a long-term situation in our state?
We've got, well, roughly right now, we've got about 80,000 on a daily basis in nursing facilities.
That's a fairly large-sized city, isn't it?
Oh, absolutely, absolutely. It's a significant challenge for us as a state. We're old and we're getting older, and you know, oftentimes our conversation at the policy level, centers around, where people ought to be served. The reality is we're getting older as a society. People are going to need all types of long-term care, and now's the time to have those conversations.
And what does it look, how would you describe it in Pennsylvania at this point?
Yeah, well, Pennsylvania, I mean, people need to first understand what's out there. I mean, many people know about long-term nursing facilities. Those are the 24/7 skilled settings, where when someone needs heavy, intensive skilled nursing care, we're talking they have an IV, they have a feeding tube, they may even be on a ventilator of some type, that those individuals get that on a 24-hour, 7-day-a-week basis. The next level down in Pennsylvania, there's assisted living residences and personal care homes. Those are also 24/7 settings where your care needs are met. The folks who would reside in those settings need a little less care. They don't need the heavy, intensive medical care. They need assistance with going to the bathroom, bathing, maybe getting up and down the stairs, making their meals, some cueing on, hey, it's time to take your medications.
These are big decisions. So, I mean, just anecdotally, and I know this is not scientific, when I run into people who live in a facility, they're still active and they love it. They formerly had, homes they were taking care of. They really do. They love the camaraderie with other people, the ability to sit down, have breakfast or lunch or dinner in a common setting and be able to do recreation. And I think that helps sustain people when you reach these so-called golden years, right? The interaction that you get with other people. It's something,
absolutely.
You're not isolated.
That's right. Our members see that all the time. We have someone they've done everything they can to avoid that day that's going to come when they need to move into a facility. And once they move in, they have socialization. They have dinner partners. They have friends who they're playing cards with in the afternoon. They're not living
isolated, waiting for a call from a relative. And I don't mean that meanly, because everybody lives busy lives. But go ahead, Finney.
Well, no, and we have Skype now. So, a lot of folks Skype back and forth with grandchildren from across the globe or across the country, but you're absolutely right. Isolation, we know, for our seniors can be one of the most damaging things to their health. And many of our facilities, and our member facilities in particular, can end that isolation so that they have a robust social life.
All right. So how do you know, you sit down, you're having this conversation, how do you know you made the right choice?
Well, yeah, first you got to have the conversation and ask the question and sit down and say, look, this is an important issue for all of us as a family, mom, dad, whomever. If the time would come when you can no longer safely take care of yourself here in the home, what would we do? That starts the conversation. Then you start researching options. And we, on our website at the Pennsylvania Healthcare Association, we have a link, www.findpacare.org, and I think our viewers will be able to see that link during the show, Terry.
Okay. It's right there now. It's on this.
That'll help you kind of get a sense of what's out there and what's available. And we've always said, and when you and I have discussed this in the past, do some research, pick some options, and then go visit. And go get a sense of what's out there, what the options are. Talk to staff and other residents and families and see whether it's the right fit for you.
And maybe you know somebody who's already in a facility, right? Who can talk about what life is like, what they should look for. That's great advice. Now the other aspect of this is, why are the holidays a good time to do this? Because we all get together and we don't do that in some families frequently?
Yes. In essence, yeah. I know we all might think, hey, there are better times than around, the Thanksgiving table that just passed for many of us, or the upcoming holiday tables that are, as we move forward. It's an uncomfortable time if we're not going to be talking about the election results, which you're all getting to next.
That's even more uncomfortable.
That might be a little more uncomfortable than talking about long-term care, but it's never easy to talk about.
Yeah, that's right.
But there's no better time. And if we let it go, we know most people run into problems because this comes up unexpected. Long-term care isn't something that's kind of a journey.
Right.
It happens. There's an event. My own grandmother fell in her driveway. That started her long-term care journey. She broke a hip, and that started her journey unexpectedly. And if we hadn't done the planning beforehand, it would have been a much more difficult process for the family.
Now, but as you say, there are people who just simply say, I don't want to do this. I'm comfortable in my own home. I mean, that's not an easy decision to move people to get, they've been in a home in some cases 30, 40 years, even longer, and all of a sudden you say, well, you're going let's talk about going somewhere else.
Well, I hope it's not an easy decision. I think, first of all, there's some, the kids probably aren't all even in the same place. You're not getting rid of my bedroom versus, holidays are a time to start the conversation, not necessarily finish it. We all know, I frankly work best by someone introducing an idea to me first, and I'll say no the first time. I may say no the second time.
You want to mull it over.
I'm mulling it over, and I'll come to that conclusion myself.
Yeah.
And so helping our loved ones and our parents start thinking through, well, gee, these are things I need to think about. I do need to plan for where I might end up. That's really important for a family. So when that time comes, usually it's almost always a much better conversation than it would have been if it was the proverbial crisis.
All right. Well, look, thanks for coming in. I think this is very helpful. I hope that I'm sure the viewers out there have gotten some helpful tips, and we had your website URL up, so they'll be able to log on to that and check it out.